So good morning, everybody, and welcome to our March meeting of the Plymouth Food Aid Network. We've got an action-packed agenda full today for you, so we're going to get going pretty quickly. So first of all, we're going to have Nigel Tremlett from Transform Research, giving an update to you all. Then we'll have a bit of an introduction from all of you and just some updates. Then Ian Smith from Food Plymouth is just going to give a strategic update on things that have been happening since our last meeting. And then we're going to listen to Martin Mills, who's got some information and hopefully some support for you volunteers, which will be really interested. There's going to be time for Q&A after each speaker as well. And then afterwards, we'll have a time for discussion. So if it's all right with you, Nigel, I'm going to hand straight over to you.
Yeah. Thank you very much, Tammy. I apologise, I'm going to have to crack through this very quickly, but I do have to go off to another meeting. If you don't ask questions, you don't get a chance to ask questions today, I'm happy to take them by email afterwards. Just a little bit of background for those of you who aren't familiar. Transform Research, we conducted the food insecurity research for Plymouth about 15 months ago, December 2021, January 2022. That piece of work was both preceded and followed by similar studies across all of Devon. And the most recent Devon one was published in January of this year. It was actually conducted in September and October of last year. But as a result of that, Ian asked me to look at the Plymouth findings from 2021, January 2022, and see, really what could we say about the current situation in Plymouth, given what the more up-to-date Devon findings were telling us. Now, it's a good idea to ask that question, but obviously there is a string of caveats attached, not least, of course, is that Plymouth and Devon are quite profoundly different places, as you will be all too aware. But what I'm hoping to do in the next 5 to 10 minutes is quickly run through the findings from Devon and look at what they might mean for Plymouth in terms of changes that may well have happened in the intervening period. And I'll be starting off by talking about what the caveats are in making those comparisons. And then I'll go on to talk about what, taking into account those caveats, what we think the current situation in Plymouth might be. But some of the caveats, as you'll see, are obviously quite significant, not least of which is we don't know, without doing another survey, what the situation in Plymouth is, and this is using the Devon findings as proxy. So please bear that in mind. Now, the most recent Devon study, as I said, was conducted in September and October of last year. So that's the first big caveat. It's already itself 6 months out of date. Although it was a very big study, 1,200 households, things have changed substantially over the autumn and obviously over the winter and to now, and not least there's been a very major cost of living crisis which has impacted households across the country. Now, the original Devon study, dating from way back in March, April 2021, produced some baseline findings for the county, and the more recent one compared the baseline from 18 months before with the situation in September and October of last year. And that showed that there'd been a significant increase in food insecurity amongst households, rising by about 17%. So that's the households that were either in low or very low food security, rising from 17% to 29% of Devon households. The increases were broadly the same for those households that were in very low security, rising from 10 to 16, as for those in low security, rising from 7 to 13%. But nonetheless, overall, a very, very marked increase of about 12% across all households moving into those insecure categories. Now, as I said, the key question for us then is, can we use that as a proxy for Plymouth? Does that mean there's been a similar increase in Plymouth? Now, the first problem we've already identified, the timescales are different. The second problem, of course, is that the household characteristics in Plymouth are different. Now, I can't do anything about the timescales because I can't obviously alter the fact when the surveys were done. But what I can do is talk you through the differences in the samples and the profiles of households, so you can get a better feel for things that will be impacting on the overarching rates of insecurity. Now, on the surface, we might feel, well, both Plymouth and Devon have been subjected to the same problems that has affected the economy nationally. There's obviously been changes in the cost of living, inflation, fuel price increases, wage rates and unemployment levels. Those are all very national things. However, we know that, in fact, the economies in each of the areas are different, and crucially, in terms of the approach that we've taken, the composition and characteristics, and specifically the income of households in Plymouth is different to that in Devon. And of course, it's those factors which lead to the degree of impact that, the degree to which they are suffering from food insecurity. So it's understanding those differences in the household characteristics, which is key to understanding what the impact will have been over that period of time. Now, what we found looking at the two Devon samples from 2021 and 2022, that although I've given you some overall headline changes, in fact, the changes were significantly different in particular types of households, and also the profile of Devon households had changed. And it's this that I will keep coming back to. So, for example, comparing our 2021 sample of Devon households with our 2022 sample, over the 18 months, there were proportionally more Devon households with a lower annual income, less than 20,000. So there'd actually been an overall decrease in income. And what that was offset to some extent by was that proportionally more of the households were in receipt of benefits, because obviously as their income decreased, more households were eligible to receive benefits. And this also correlated with the finding that fewer of the households actually had a main respondent who was unemployed and or seeking work. Now, these findings to some extent reflect national patterns where we know there's been much higher levels of vacancies and a lower unemployment rate, with more households having at least one member who's economically active. However, although more people have got jobs, many of these jobs, of course, are not well paid jobs, and the households still need income support from the benefit system, particularly households with children or where there are household members who are ill or disabled. So what do those changes mean in Plymouth? Well, in a nutshell, what they mean is that compared with the findings we had before, is that there will have been an increase, and that's undoubted. The difficulty we have, as I said, is without knowing what the current profile of Plymouth households is, it's very hard to give a precise estimate. Now, I've circulated to Ian a paper with some details for different types of households in the city. I suspect some of you may have seen it and some of you won't, but I'm happy for it to be circulated to all. And this gives a breakdown for different types of households in terms of their key characteristics about what we estimate the increase in food insecurity would have been over that time period. What would be really helpful, and I believe it's going to be available within the next few months, is some updated stats from the government on the profile of households in Plymouth. The most recent information that's available from ONS is from September of last year, which unfortunately isn't very helpful. But as I said, I believe in the next few months there will be more detailed information, and I would ask Plymouth City Council to get their hands on that. It's possible sometimes the councils are given headline findings in advance of what's made available to the public. So as soon as you can get your hands on that, particularly to look at things like income, tenure, benefit receipt and so on, the key things which impact on food insecurity, I would encourage you to do that. Overall though, what I will say now is that food insecurity levels have clearly gone up in Plymouth. Our best estimate is that they've gone up from about 1 in 5 to around a third, so around about 32%. The types of households that have been worst hit are those on low income, those in receipts of benefits, particularly those in legacy benefits, but also even those on universal credit, the more up-to-date benefit. What's interesting in terms of the activity, the main activity of the main household respondents, is that there's one group that is relatively insulated from all this, and this is consistent nationally as well. It's the households where most people are retired. And this is obviously because they have a different set of outgoings. They're less likely to have children. More often than not, they've paid for their accommodation, so they're less directly impacted. And the increase amongst particularly retired couples is much lower than in other groups. I think what perhaps is surprising is the increase amongst households where there are both full-time and part-time employees, where there's been big jumps. But again, this will be those households where the full and part-time employees are on comparatively lower levels of income. There's also been big jumps in households where there's at least one member with a physical or mental health condition, jumping up, very significantly, way above the 12% that I was talking about on average, up to about 20% increases. What this means overall is that the types of households which are likely to have the highest level of food insecurity in Plymouth, our current estimates are that it's basically households with income of under 20,000 and with children present. Probably around about 2/3 to 3/4 of those households will be experiencing food insecurity. Single adult households, where a similar proportion will be experiencing food insecurity, and it's pretty much across the board for them. Households where there are people who are long-term sick or disabled, households where there's at least one member with a mental health condition and or a physical health condition, and also those households where the main respondent is unemployed or in receipt of benefits. Now, obviously, those findings are deeply concerning and very worrying. They do closely mirror what's being reported nationally by organisations like the Food Foundation and the Trussell Trust. I think probably the one big overarching difference from the report that I submitted to you for Plymouth from 18 months ago is this finding now that there are more and more households where people are in work who are struggling, as well as those groups who have been identified before. And that's obviously those households where they're in work, but the levels of income are still quite low. And that's obviously to do with their levels of expenditure related to their housing costs, childcare costs, etc., etc. So I'll pause there to give some opportunities for any questions that anybody has. As I said, the paper is available through Ian, and I hope it's of some use. Thanks.
That's great. Thanks, Nigel. We have had one question that's just come through the chat. Is it possible to send the survey out to a sample of some of the service users in each of the venues to get a small but good reflection of how things are in Plymouth right now?
Well, the questionnaire that was used is available in the report from last time. So if an organisation and provider, whoever it is, wants to use those questions and send it out to their service users, they're absolutely fine to do that. We've got no problem with that. I should say the questions are based on questions that are used both nationally and internationally. They came from the United Nations Food Health Organization in the first place. So they're not, if you like, our copyrights, they're nationally available.
That's great. Thanks, Nigel. Has anyone else got any questions for Nigel? Everyone's very quiet. I'll think of them later, Nigel, when you've gone.
Well, that's fine. They can email me. Yes.
Brilliant.
Tammy, could I just ask one?
Yes, of course.
I'm just following up on the previous suggestion that we could use the questionnaire with the clients, and presumably the point, Nigel, is that your survey goes to a random selection of households.
Yes. Yes.
So you can't biasly sample people who you already know are in need and say, good grief, 100% of them are in need.
Well, I mean, you would have to massively caveat to say this is a survey of your users. And what it would enable you to tell is what the difference between your users is and the population as a whole. So you might not find that they're all in need, and it would give you an estimate of the degree of need. So that might be of interest to you. But yes, you're absolutely right. Obviously, it's not. It wouldn't be a representative sample of the population. It's just your service users. Yeah.
Thank you.
Yeah.
Just on that subject, I think it might pay, because I've already raised this with Rachel Silcock and with Ruth Harrell, the Director of Public Health, around the possibility of repeating the previous exercise to get an accurate take on Plymouth. And that hasn't been taken up or run with at the moment, but it would be worthwhile, and I will do that. I'll take that back to them and say there was interest, because I gather there is from this group, which doesn't surprise me in the least in that, and see where that goes as well. Because that would, if they wanted to commission something, it would give a very objective, accurate take. But anyway, that's one to follow up on. So I'll take that as an action as well. Thank you.
Thanks, Ian. That's really helpful. If there's no other questions to Nigel, feel free to stay, Nigel, but I assume you've got to go because
I'm afraid I have. Yes, I'd love to stay, but yeah, thank you for your time, and I'm sorry to have to present such not very good news, but it's perhaps not surprising news. But yeah.
Well, thank you.
Thank you very much. Thank you.
Thanks, Nigel. Bye-bye.
Bye. Bye.
So what we're doing now is just so we'll go around. It'd be lovely to hear from you all now, just to introduce yourselves and a bit of an update. So I'm just going to go from my screen really from left to right and work my way through. So Richard, can I start with you, please?
Yes, Richard Margate, Salthouse Food Bank, for anyone who's not seen me before. I think our experience continues to echo what Nigel has been saying. Demand has remained high. Increasingly, I think it is families who are in work, as the threshold of expenses have just increased way above incomes. Lots of families, lots with children, but increasingly single people. So yeah, I mean, our experience is very much the same. Demand just keeps going up. Thought supply queues, suppliers held up fairly well. We're beginning to have to buy in a few things, but we're still coping basically with voluntary support from the community.
Thanks, Richard. Kelly.
Hi, so I'm Kelly, the cooperative food organizer for Plymouth. Yeah, it's going very well. So we are in a place where we are looking to start our 3 trials from mid to late April, and we have them in place now. So we have a base for our food co-op. We have 2 bases for our food co-op clubs, and we have 1 for our social supermarket. So we are set up, and we've also had a school now interested in our food co-op. And the university are interested in our food co-op as well. So yeah, that area, that aspect of it is going really well. And working with Fair Share, they are opening up more slots actually. So that part of it has worked very well. Where there has been a huge wait list before, they are able to offer more slots now. So that's great.
That's great. Thanks, Kelly. For those of you, some of the people that may not know what the food co-op or the food co-op club is, or the social supermarket, could you do a very quick, on that? Would that be okay?
Yeah, sure. Okay, so a food co-op would be 20 people, around 20 people coming together, and you would live in a location where you can all come together, or you would visit somewhere where you all come together, like a school, a university, a church, that kind of location. You would get surplus food, and you all would put in some money every single week. So let's just say £5, you all put in £5 every single week. That covers the cost of the surplus food, and the money that's left over, you decide on like a shopping list together. We bulk buy that from somewhere like Booker's, for example, and then you split it down. So big bags of pasta, that kind of thing, and then you split it down together, and then you have that shopping together as a group of people. You split it down together as a group of people, and you take it away as a group of people. It is a cooperative, so it is open to everybody, and there will be an element of education. So we'll follow the 7 principles of the co-op. And then the food club, so very similar to the Devonport model, if you've seen it before. So you would join, you would become a member, you would come during the week. It would be open once in the week for a certain amount of time on a certain day, and it would be access to a certain amount of items for a certain amount of money. So let's just say 12 items for £3.50, for example, and you'd pick from various items. And then there will be help and advice when you're there as well. So from PEC, from Citizens Advice, different people each week. So you have access to more than just food. And then the Co-op supermarket is very similar. So it would set up and it would look like a supermarket, but it is a social supermarket. So again, so many items for so much money, and you pick from various shelves. And again, the element of further education. So like PEC coming, or you, Tammy, from Food is Fun, that aspect of actually what do we do with these ingredients that we've got? What can we make? It is in no way your whole shop. This is meant to alleviate the pressure of like the current climate around food. That's what this is meant to do. So yes, those are the three models that we're trialing, and they are all built into a joining something, belonging to something, having a say in that, how it runs, how it works, the element of education that's included in it. So yes, those are the three. Any questions? Did I cover everything? Good.
I think you did. That's really helpful. It, really makes that very clear, I think, for everybody as well. So thank you so much, Kelly. That's really good. Lindsay, can we come to you, please?
Yeah, and I'll pass on to Hilary in a moment, but I think that the main message is that our numbers are going up, not massively, but steadily each month, a few percentage more people. And I think the striking thing is that people are coming out in the most horrendous weather to collect food. And that's the thing that's really impacted on me. We had our busiest Saturday morning for rough sleepers last Saturday. And that's that service where we try and combine providing advice, food, access to some healthcare as well. But I'm sure Hilary will have more to say.
No, I haven't really got more to say. Lindsay's covered it. I think the important thing for us is that it's about way more than food. It's so much to do with relationships and supporting people and being there regularly 7 nights a week, providing a listening ear. Yeah, that bit's really important. Perhaps an increase in the complexity of some of the people that we deal with. The police are in contact with us regularly. We work with the rough sleeper team. So those contacts are very important. We still get emails, phone calls about emergency food aid. So Plymouth, the safeguarding person from Plymouth phoned late on Monday night to say they'd had an emergency referral for somebody who hadn't eaten for about 3 days, had complex health issues, no electricity in the house, and could we get food there that night? So, yeah.
Thanks, Hilary. Eve, over to you.
So Eve at 4 Greens. I think just saying the same things that people have already said, to be honest with you. There's so much going on here in the centre, but some of it I don't know about, and some of it it's not time yet. But I think I would just agree with that. The numbers are going up steadily. They are going up, and it is steady. It's not enormous jumps. But there is, yeah, definitely a greater need. And I think, you know, that we give out the emergency parcels, which are just as one bag with some very basic items in, for which people don't have to commit, you know, they don't have to tell us this story. They don't have to then be looking at what other help they might need, and which are all longer term things, obviously. But the demand for those, they just fly out with. I don't understand. I don't have all the details for that, but I do observe that that is happening. But overall, so much going on here, and the community larger, heaps of people. And I think the number is around 70 a week, something like that. It's massive, yeah.
Thanks, Eve. That's really helpful. Diane.
Hi, yeah, so I'm from the Village Hub. We're based in Stoke. Like everyone else, we're noticing increase in numbers of people. We seem to be getting less from Fair Share, and well, it just seems less, or if it's going quicker, I don't know what it is. We're looking at changing our model. So at the moment, people could just come into our larder and just take what they wanted. So we're now looking at sort of if we just concentrate on 2 days that we open, because by Wednesday we've hardly got anything. Do we charge per bag? Do we charge membership? So yeah, we're researching that at the moment, asking people questions.
Thank you. That's really interesting. Might be worth having a chat with Kelly.
Yeah.
So when I came in, I have obviously been in, Diane, haven't I, and I met you, but we were just looking at the one model then, which was our food co-ops, and that's changed now with the 3 models that we're looking at. So yeah, if it is of any interest at all, or we can be of any help, then and just let me know. We know that this doesn't fit everybody.
Yeah.
I spoke to V about it at Stonehouse, but there might be elements that fit.
That's true. Okay. Thank you.
Thanks, Diane. Thanks, Kelly. We'll come to you, V.
Yeah, so hi, I'm from the Stonehouse Community Fridge. Numbers are steadily going up, food's going down. We're getting less from the supermarkets, less from Fair Share, less donations, less of everything, and more people coming in more desperate need, I would say. They haven't eaten, they haven't got electric, people are coming in and they're distraught and for a number of different reasons. And they come in, have a chat, a cry, someone listens, we can help with a bit of food, we can help with a bit of electricity, and they go away slightly better than they came in. But it's not going to fix the problem. It's just firefighting, I think. The much bigger problem and more complex needs, I guess.
Thanks, V. That's really helpful. Hilary, you've got your hand up.
Yeah, I'm interested in this bit about Fair Share, because my understanding is that we pay in our monthly subscription for a certain weight of food. So if we've paid money for a certain weight of food, what we're given shouldn't decrease.
We are being given our weight of food. I think what's changed is what you'll get if you get a lot of heavy items, then you get a lot less stuff. So we're getting bottles of water, bottles of milk, bottles of this, and it takes up a lot of your allocation of food. But they haven't got the fruit and veg that was sort of like giving you that what seemed like a big delivery, because they either have, I'm assuming they haven't got it, otherwise they'd be trying to give it to us. So I think it's just the items that we're getting has changed. So I guess they're being donated different kinds of stuff at the moment, whilst the supermarkets and everyone is sort of sorting out this problem with fruit and veg and stuff like that. So what we're getting is different. And if you've got lots of heavy items, you give out 10 and it just doesn't feel like it's going very far. I think Diane, I guess you would probably agree with that, if that makes sense.
With the word less then, because we're
still
getting the allocation
we're getting our allocation, but
I understand what you're saying exactly, because we're the last pickup on a Friday. So we do the last pickup on a Friday. They've been phoning me on a Thursday recently to ask if what they're allocating is useful or not. And that's quite helpful when those phone calls take place.
Yeah.
But there is a decrease in fruit and veg, although last Friday, as we arrived, a whole pallet load of bananas arrived. But they have no control, do they?
No, I know, yeah.
So
I think it's just the combination of that. We're getting less that you can pick up from the supermarkets because everyone's buying the yellow sticker stuff, or they're they're buying, you know, there is just less food sort of available at the moment.
Absolutely. It was just that I was checking because, you know, we've paid in and we, the rest of you, I just literally got my invoice through for this year. Have your invoices all come through late?
We paid up front from HSF funding from like last one. So I'm in advance at the moment.
Okay.
But I might get a new one soon.
Yeah. Well, we're in deficit, so okay.
Yeah.
No, that's great. Thanks both. Emma, can we come to you, please?
Yeah, hi everyone. I'm here from the Independent Food Aid Network. We were invited by Ian, which is really good because we do a lot of work in Plymouth and we've kind of reactivated what we've done previously. I think we're also invited to the next 2 meetings as well. So we'll share more in detail about what we kind of do. But a quick synopsis maybe is that we have a Worrying About Money leaflet in Plymouth and other areas as well, but in Plymouth especially. And most of you or some of you probably have already seen it before. But it is literally a simple resource for people facing money worries and financial difficulties or who are in a financial crisis, as well as support workers or frontline workers who are kind of facing people who experience the issues. It's a step-by-step guide for people to follow. I'll actually send the links through now so that you can potentially see the leaflet from the first link I've sent. So the aim of the whole project is to literally reduce the need for charitable food aid by utilising a cash-first approach. So in this leaflet, we have compiled kind of the most cash-first approach. Sorry, my dog is making noise in the background, obviously, the second I start speaking. But yeah, so literally cash first approach to food insecurity, and the step-by-step process of the leaflet helps people identify where to actually get help and in things that they might be experiencing. So whether it's debt, whether it's trying to maximize your benefits or getting a benefit advance, you can follow the steps and the organizations that we have mentioned in the leaflet to try and get people into the right places for help.
That's great. Thanks, Emma. And we look forward to hearing a bit more from you in the next meeting. You're going to be coming along. What we'll do is we'll share that link with the update by email after the meeting as well with the recording. Rachel, sorry, I interrupted you somewhere else. Do you want to just do a quick intro?
Sorry, I couldn't find the right screen to be on. Yeah, I was just having a chat with my colleague. I'm Rachel. Hello, I'm from Citizens Advice. I've just taken on a new role as a caseworker down at the Oasis project down in Plymouth. So I'll be there Monday, Wednesday, Friday. And basically I just provide advice and long-term, I can work with clients long-term to help with more complex issues. So things like, I had a chap come in yesterday who's in debt. He didn't know anything about discretionary housing payments, anything like that. So my role is to sort of give advice and to support them long term so that hopefully they don't need to come back to the food bank. I am seeing quite a lot more people with more complex issues, people that haven't really been to a food bank before. So they don't really know, and they're not aware of the support that's out there at all. I think we're also seeing people who are coming. This may just be the Oasis one, but we're getting quite a lot of students who are they've come from abroad and they've just been told to sort of come down to the food bank and they can just get a parcel and they don't need a code or anything. So that, I think that's becoming a little bit of a problem because they're just being told that they can just sort of turn up and they'll get free food when actually, and then we've got other people who are waiting stood out in the rain, which isn't ideal. But I think it's, people definitely seem quite desperate. You know, they're prepared to stand out in the rain for like an hour sometimes just to get like a food parcel. But yeah, I try and talk to as many as I can to see if I can do long-term support. That's kind of it.
No, that's great. Thanks, Rachel. It's really helpful. Nice to meet you. And welcome to our first meeting for you. And we'll hope to see you again. And if you want to come along and have a bit of a longer time to speak, you're more than welcome to do that. Just let us know directly and we can book you in some time. That'd be great. Sally, I don't know if you're in a position to be able to speak, but just if you wanted to say hi. Not sure if we can hear from Sally right now. I know John's got some tech issues as well. Do you want to see if you're...
Hi, can you hear me okay?
Yeah, we can hear you.
Well, it's now a cat issue. She's just knocked a flower off the windowsill, so hence me disappearing for a minute. Yeah, hi everybody. Sorry, I've had some technical issues with my system this morning. Just 3 things really as an update. I've been in touch with Ella recently to add a few more churches to the map, to the food aid map. It was interesting actually, because some of the churches thought they were on there, but I said, no, you're not. So we managed to add, I think it's 4. And I'm still working with others to try and see if we can get them on there as well. Sorry, I'm out of breath trying to catch the cat. It was interesting, I heard Emma say about the cash first principle. It's very much TPT's focus now is to encourage, where possible, any church who's with some sort of food aid facility to try and look to shift towards that model. It's quite countercultural, as I'm sure you'd understand, for most churches to do that. However, we've got some traction with a couple. In fact, Kelly and I sorry, Kelly, you may have mentioned this. I couldn't get in and couldn't hear you, but we met with Mutley Baptist, for example, yesterday, and they're keen to take it up. So we're hoping that will be set up fairly soon, trialing it at least to see how it goes. And so that's a big priority for me within my role. The other flag I would mention, we've got this Feast of Fun funding, which is now going to try and tackle some of the issues around holiday hunger for the schools, for school children. We've got funding to provide £2.50 a meal from age 0 to 18. Again, it's a bit patchy at the moment. Some of the churches are very keen to do this, but others just don't necessarily have the right facilities in the right place to do it. And it seems to be that although they've got obviously holidays coming up, half term, Easter and summer, it looks to me as if the vast majority of the focus will be around the summer holidays, where they'll hopefully be able to provide, say, at least 1 meal a week, possibly more during the summer holidays. So that's an update from me.
That's great. Thanks, John. Martin, if you just want to say who you are and where you're from, and then what we'll do is I'm going to gloss over you because I'm going to come back to you, if that's okay.
Yeah, no problem. Hi, Martin Mills. So I'm former director of our Plymouth. I co-chair the Plymouth Volunteer Managers Network and currently head of engagement for Engaged Communities, CIC, which I'll be able to talk to you a bit more about all of those in a little bit.
That's great. Thanks, Martin. Hi, Ella. Nice to see you. Do you just want to just say hi briefly to everybody?
Yes. Hello. I'm sorry I'm being so late. Just double booked today. So my name is Ella. I work for the Diversity Business Incubator in Plymouth, and I'm also working in collaboration with Tammy and Ian from Food Plymouth and Plymouth Food Aid Network, and I was involved in updating all the information about the food aid and causes around Plymouth. So updating the aid order map.
It's looking very good. It's all green. There's no reds, which is brilliant. So well done.
Yes.
Ian, I'm not sure if you're still there. I know you were going to give a brief update from what's been happening. If that's a good time for you to do that now, you're on the roam.
I am. Yeah, I'm now moving, but I'll stop moving. Yeah, thank you. So first of all, I think the important thing is this whole emphasis on the cash first approach and the worrying about money leaflet. So thanks for all of you that came back when we consulted on that. And it's great that this refreshed version of it is available. And it's great that it'll be coming out to you, you know, via the updates, which Tammy provides each time. With that, I've sent on the information that Nigel Tremlett provided. I wanted Nigel to speak to you and explain it before actually giving you the figures and the information. I thought that was the best way of doing it. So Tammy's going to kindly put that onto the update as well. So we'll have the document that Nigel mentioned. We've responded to your comments from last time around the whole issues around volunteers, volunteer management, volunteer potential burnout, certainly vicarious damage that they're receiving through the work that they're doing, and it's brilliant that Martin can come to talk into that and brief you on the resources that are available. And Neil Minion from the City Council, who works very closely with Martin, is massively supportive of this as well. So that's an important development that we'll run. So that's good. Other than that, I think the key thing going on is that really the people in and around the whole food redistribution piece in and around Plymouth have come together, and there's now a food systems group meeting. So that involves DCFA, DCFA Plymouth. It involves Fair Share. It involves Carl and John and people associated with the ARC and the Co-op. Kelly comes. And there's another meeting of that group coming up later this month. I think it's the 28th, to which will have implications for this group, which we'll keep you posted on. I'm absolutely delighted the way that Kelly's role has kind of expanded into trying these additional methods to the ones that originally she came in to do. And it's brilliant that those are actually being live tested. This is nothing like doing something to find out what works, what doesn't, and how then you know what you need to problem solve. So that's a really excellent sort of practical set of steps going on there. And I think this whole business of moving towards the social supermarket, affordable food club, addressing the whole working poor issue, which the social supermarkets, affordable food clubs and related things can do, is brilliant. And the whole cash first benefits everyone. So I think that's the broad strategic direction. So we keep you posted on that as we go. But it's brilliant to have such a big turnout today. I'm sad and I'm not surprised, but I'm disturbed by the levels of need that are, genuine need, which are coming forward. So I think that's the thing, is to try and get people to have the maximum amount of money and resource they can to buy their own food, rather than be dependent on surplus, which can be variable and is in, how can I put it? It's not in short supply, but its supplies are stretched. Interestingly enough, on the Food Sequel project, the Food Systems and Inequality project, which amongst other things, Eve is very much involved in, there's a lot of interest there about how those of us that are fortunate enough, are in the primary food system, where we just go and buy from a supermarket or a store or whatever we do, we can afford reasonable food and on a decent basis. Really, that project has picked up, what I suppose we all know anecdotally around how people in food insecurity are so dependent on a sort of secondary food market from the surplus side. And I think the main thing is to move as many people as possible into the primary, rather than get into that secondary and hybrid model that is the case. So I think that's an important emerging piece coming out of Food Sequel. So again, I'll keep you posted on that as it comes. Anyway, I'll stop there because there's lots more to do and time is tight. But thank you very much.
Thanks, Ian. That's really helpful. Just a quick update from Sally, who's unable to speak due to tech issues. Just wanted to say that she's from Family Hubs. She's new to the role, and she's going to come along to the next meeting and just have a chat about what she does and how that can help you and some of your service users as well. So Martin, we're going to come to you now, if that's all right. Sorry to have left you to the end, but we always stay,
Yeah, no problem. And I think I'm fairly short and sweet as well. As I mentioned in my intro, so I'm former director of our Plymouth, and I don't know if any of you were familiar with our Plymouth. We built a website during the COVID pandemic to help with volunteering, recruitment, and deployment. I'm still personally working on some of that, in that we were responsible for all of the stewards that work at the mass vac centres in Exeter and Plymouth. So I'm still managing around, it's come down a little bit now, but it's probably around 1,100 volunteers across the 2 sites, ready for the spring booster programme. The learning from all of that, there were 2 pieces of learning. One is that nobody wanted to fund us for doing that stuff particularly, certainly not enough for us to make it sustainable. The other thing we learned is that there isn't any software available that you can buy a license for that does a whole package of volunteering stuff. So from recruitment right the way through to deployment and rotoring systems. So the stewards at Home Park and at Greendale log onto the system, they look and see what shifts are empty and they choose their own shifts, all sorts of stuff like that. And there isn't anything that does that end-to-end experience. So a sister CIC called Engaged Communities has now built something using all of the stuff that we learned. And that's just in the kind of process at the moment of being launched. It loses the Plymouth centre focus because it's now just called Go Volunteering. Whether that's going to be of help to most of you, because it sounds like you're all very much kind of grassroots, a lot of volunteers, not a lot of money, and obviously the idea of a license system is that it costs money. So around that, the only thing that I could come up with when I was chatting to Ian and Tammy last week was whether there's an opportunity to club together collectively with some of the people that aren't here at the moment. So, and I don't know whether they're part of this group or not, but I've heard you talk about fair shares. You know, we've recruited quite a lot of volunteers for Fair Share. Devon and Cornwall Food Action, we did quite a lot of volunteers for. So whether there's a bigger picture where this group and others in the city that are involved in the food could have one license collectively, that everybody chips in a little bit of what they can afford and they have one license to help with volunteer management. But that's kind of an aside, because that's, you know, that's my new kind of role with Engaged Communities. In terms of helping with volunteering, I suppose the biggest thing that we thought of, again, with the meeting that I had with Tammy and Ian on Friday last week, was around the volunteer managers network. So I co-chair with Neil Minion that Ian mentioned a little while ago from Plymouth City Council, is the volunteer manager there. I co-chair the Plymouth Volunteer Management Network, and that's why he's not here today, because he's chairing that meeting today that's going on as we speak, and I've come to this one to meet you. And again, I don't know how much help we can be, but if there were representatives from here, whether it was you know, one person that comes and joins the volunteer managers network to see if there's anything that you can sort of glean from there, or any extra help you can get from there, and then you report back to this group, or whether a couple of you wanted to come along, the door's open, and it'd be lovely to see you and see where we might be able to help. We've got about 45 volunteer managers in the city that all come together. I mean, not every meeting, but we meet about every 6 weeks. And we've got like a Google Docs where we all share information and best practice and help each other out the best we can. And it's really nice to see people working collaboratively, even though secretly we're all competing for volunteers. But it's quite nice because we are all working together, and that, you know, I think that's the way forward. So if anybody wants to join in, get involved, come along to one, just, you know, let us know. And then if there is a conversation to be had around perhaps getting a license for more volunteers, you know, one of the things that we talked about last Friday was that that some of you have got volunteers that are doing far too much and it will burn them out. And I suppose the easy answer, although it's not easy to do, it's just easy to say, is if you had 4 times as many volunteers, then they'd only have to do a quarter of what they're currently doing. So therefore they wouldn't burn out as quickly. But that's something that we perhaps can discuss offline with maybe a smaller group. I don't know, however you want it to work, and wherever we can help out, either as engaged communities or as the Plymouth Volunteer Network, more than happy to help out. Does that kind of...
No, that's great. Thanks, Martin. There was a question. John, there you go.
Yeah, I was just going to ask Martin, I mean, you have these meetings every 6 weeks, you say, and you share best practice. Would it be possible for that information to be imparted to PFAN, to this network?
Yes, well, I mean, that's kind of the point, is, you know, perhaps somebody from here could join and be part of that group, and then that one person could be responsible for reporting back to all of you. That was kind of what I was thinking.
Okay.
Would that work, do you think? Is there somebody that... And I'm kind of guessing from listening to you, and I have to say, it's really humbling to listen to the work that you're all doing. And I get the impression, and I don't really know, but I get the impression that a lot of you are volunteers as well. So it's not like you're being paid to do this stuff. So it's very humbling to hear the great work that's going on. And obviously I hear a fair bit of that from Ian, because Ian's the man that turns up at different networking events that I'm at, and I hear him shouting about the work you're doing. He really does. So but it's humbling to hear it firsthand. But if there was somebody, it might be nice if it was somebody that gets paid to do some stuff that could come along and then collate that information back to you all.
Yeah, I'm happy to come along, because we're going to look at our volunteer policy at the moment. So I find it useful, and I'm paid member of staff at the Village Hub.
Brilliant. Yeah, that'd be great. Karen's got my email if you want to check out. I know Karen quite well. So
yeah, and I think also it's something that we can factor into the conversations around the what next for the Food Aid Network, and shifting across more to the alliance model that we've spoken about so many times before. So it's brilliant that you're going to do that, Diane, and thanks Martin. That was brilliant. So yeah, let's keep that conversation rolling and make sure we do something really, useful about it. Thank you.
That's great. Yeah, thank you. And Diane, are you happy to feed back to this network?
Yeah, definitely. I'll be in touch then, Martin. I'll get your email from Karen.
Brilliant.
That's great. Thank you. Has anyone else got any questions for Martin at all? No.
Oh, I got off light.
You did. They'll all come flooding in, Martin. Don't worry. No, there'll be a flurry into your inbox very soon. Would you be able to just share your email address into the chat, please, so people could have that?
I was just thinking that.
That would be really helpful. And then obviously we can circulate it, but it would then go to the whole network. So as long as you're happy for you, will get a flurry of emails into your inbox. That would be great. So I'm just going to stop the recording now anyway. So for those of you that are watching, thank you for joining us. And we look forward to seeing you next month.